Guys, welcome to HIMSS 26 in Las Vegas. Are you guys excited to be in Vegas? All right. Yeah, well, I'm excited to be here. My name is Brad Whitchurch. I'm the founder and CEO of Seal Shield and host of the CleanTalk Podcast. We have Isis Lamphier is joining us. Isis Lamphier is the Director of Infection Prevention at HCA Florida Brandon Hospital and a board-certified infection prevention control leader. She brings extensive expertise in CDC guidelines, Joint Commission standards, occupational health protocols, and federal and state infection control regulations. Prior to joining HCA, Isis served at Moffitt Cancer Center, first as an infection preventionist and later as manager of infection prevention and control. In her managerial role, she oversaw infection prevention efforts across all campus facilities and provided specialized expertise in protecting oncology patients. Her earlier experience includes serving as an infection prevention control officer at Southern Healthcare Management and as an epidemiologist with the Florida Department of Health, where she also contributed to the state's COVID-19 vaccine response. Isis is an active contributor to the infection prevention community. She serves as an author, contributing editor, and editorial advisory board member for Infection Control Today, ICT, and has written for the Joint Commission's The Source and publications affiliated with the Association for Professionals in Infection Control and Epidemiology, APIC. She also served on the advisory board for Joint Commission Resources and participates on multiple professional boards dedicated to advancing best practices in infection prevention. She's also a former CleanTalk guest, so we're really excited to have Isis back. And joining Isis today is Christian Davis. Christian Davis is the Chief Technology Officer and the leading innovator here at Seal Shield. Ladies and gentlemen, please join me in giving a warm HIMSS Seal Shield CleanTalk welcome to Isis and Christian. Thank you, guys.
Brad, thank you for the introduction. So we won't go back through that. You guys have got a feel for where her background was from. But so with your recent transition to HCA, there was a lot of infection prevention that I'm sure you learned in an oncology-based hospital. So maybe you could walk us through some of the unique experiences from Moffitt and how those are carrying over into HCA.
Yes, I recently made the transition from Moffitt to HCA. I've been at HCA now about 5 months, and it's been an excellent transition and moving from immunocompromised patients now to immunocompetent patients. And Moffitt taught me a lot, especially how small things can make patients sick. For example, bringing in flowers could potentially make a cancer patient sick. Animals coming to visit the center. And now working at HCA, I've gotten to experience emergency medicine, which has been really helpful, especially in the infection prevention space, because turnover is very high moving from patient to patient, and how important it is to maintain those infection prevention practices, depending on the acuity of the patient and the treatment plan for that patient. So it's been great getting to experience both different sides, and then also coming from long-term care, also seeing immunocompromised patients in long-term care and residents that would spend the remainders of their lives there and potentially be colonized with infections like MRSA or VRE. And of course, working at the Department of Health and getting to see that intersection play with the community and how we can keep community partners safe.
Yeah, absolutely. So obviously a lot of lessons learned and a lot of value that you're able to bring from Moffitt into HCA, and we'll know you'll do great things as you've done at Moffitt. So let's talk a little bit about maybe some lessons learned. So you have the maybe fortunate or unfortunate responsibility of making sure that staff knows how to work with technology, whether it was at Moffitt and now the HCA, and how that technology plays a role and potential cross-contamination vectors.
Mm-hmm.
So maybe you can talk a little bit about the technology that you see coming in from IT, what challenges it brings, not only from the technology itself, but maybe the training, some of the IFUs that you guys are responsible for training your staff and ensuring adherence.
Mm-hmm. Yes. So these are all photos that I've taken throughout the last few months, actually. My phone is always a repertoire of different photos from the hospital. So as you can see here, the first photo is a glucometer charging station, and there's been an abundance of a collection of dust because it's very hard to clean those charging ports. The second one is a dialysis machine. So we can see here how some of those knobs are difficult to clean. And then the third one is a dialysis machine, and how over time dialysis machines are very exposed to water and other sources of potential infections. and how rust has begun to develop on those wheels. And in healthcare, you're in a unique situation where the lifespan of a product might be a little bit different than what you anticipated, because you're exposed to harsher chemicals. You're always cleaning and disinfecting after every patient, water, and preventing those waterborne illnesses. So they are subjected to a shorter lifespan than what we might anticipate.
Yeah, absolutely. So materials, to say the least, play a big role.
Yes.
Right? So in this image, maybe you can give us a little insight and what we're looking at and some of the challenges here as well.
Yes. So this is a portable X-ray machine. And as you can see there, just from moving it from patient to patient, you're starting to see some scratches. It can even cause some damage to the wall, moving the machine from patient to patient. So again, we didn't anticipate for that machine to get that wear and tear, but it is part of the process, moving it from patient to patient.
So moving along, here's a couple of applications. So obviously workstation on wheels are everywhere in most facilities. And talk to us a little bit about the workflows at Moffitt, lessons learned and what you're bringing to HCA that you perfected back at Moffitt.
Yes. So these are some of the products that we brought from Seal Shield to Moffitt. So you can see there the keyboards. We also had the custom fitted screen protectors, which were really important, like Brad was saying, for HIPAA compliance. And it also assisted with cleaning and disinfecting because we are using alcohol or bleach-based products depending on the patient's isolation status every time these workstation on wheels go in and out of the room. And so those can be very caustic and break down that computer faster than you might anticipate. So we put those screen protectors on, and that was a solution that we didn't anticipate, that it would help the lifespan of the computer last longer and not only protecting against that HIPAA compliance too.
So what we're seeing is that there is a bridge between IP and IT by simply providing solutions that make the cleanability of otherwise typically hard to clean IT equipment allows a stronger relationship between IP and IT, which is good for the organization on both sides.
Yes, definitely. And these computers are subjected to blood, at Moffitt chemotherapy, disinfectants, other body fluids, or even medications, because a lot of times the nurses will prepare the medications on that surface that you see right below the screen. And that's something that might not be tested in the IT side, but it is a factor when you're bringing in the product to a hospital.
So an interesting note for those of you that have not spent, and hopefully have not spent any time in an oncology hospital like Moffitt, one of the things that's quite interesting, you heard her say that bleach is one of the targets that they use as a chemical disinfectant. And not only for the pathogens that could be looming on the environmental services.
Bleach is also used to inactivate chemotherapy. It's one of the only agents that can inactivate chemotherapy, and it can be very harsh. And you can potentially have some cross-reactivity when you're using a quaternary ammonium compound and then switching between the bleach. Because first you'll want to deactivate the chemo with the bleach, and then you'll want to disinfect it either with a quat or with bleach, depending on the patient's isolation status. Because if a patient has C. difficile or norovirus or any other type of GI bug, you're going to also want to use bleach to disinfect that surface.
Yeah, absolutely. So if you all in your hospital, I'm sure you've walked along the halls and you've seen multiple disinfectant canisters in different colors. You hear the proverbial purple top or bleach wipes, but they all have a role, right? And the dwell and the use of these wipes come from SOPs of likes from ISIS, and her organization. And that really takes us to the next topic to really allow us to dig in.